I've got a chronic illness and I was bedbound in 2020 and I'm going to tell you more about it. So I've got a chronic illness called chronic UTI. Chronic UTI isn't like a regular UTI. Chronic UTI is where you are constantly living with a UTI. And the UTI is, well, the bacteria is embedded into the bladder lining. Now, one may question, how do you even get this kind of illness? How does UTI develop into a chronic UTI? How does that impact your day-to-day life? One of the things I must say is that dealing with a chronic UTI is probably the most painful thing you will ever go through. If you've ever had a UTI, it's very painful. So the fact that your body is having to deal with an infection constantly puts your body under a lot of stress. As mentioned in my previous videos, some days where I couldn't even walk because the pain was too unbearable. But I'll talk about that another day. So a chronic UTI is where the bacteria is embedded into the bladder lining. And the reason for this is usually because of negligence. It's because you've once had a UTI, and it hasn't been treated properly. And therefore the bacteria has stayed in your bladder and then over the years embedded itself into the lining. Now, you don't get chronic UTI because you're dirty or because of sex. It's a condition and some people are more susceptible to it than others. So say you've got a UTI, you go to the doctor, you send off a urine sample. That urine sample then gets tested against a certain parameters. Now, these parameters were set, wait for it, in I think the 1950s, and they only did a study on about 20 to 50 women. These parameters that determine an infection are used to this day. So what does that mean? It means that testing misses about 70 to 90% of cases where you do actually have an active infection in your bladder, but because of the testing is still so outdated, it won't pick it up as an infection. So this is why you get practitioners like the NHS telling you that it's all in your head because their tests tell you that it's negative. However, in reality, there needs to be an update of these tests and other tests need to be done, such as broth testing, which is basically culturing the urine culture for longer, or looking at fresh urine under a microscope and counting the amount of white blood cells, red blood cells, etc. The reason why a lot of infections become chronic is because so many infections are missed. There are women living out there where the doctors are telling them they don't have an infection because they're not educated or up to date with the current standards of what testing should be. Oh, again, I've gone on too long. I'm going to have to do a part 3, part 4, but I'm going to make a series out of this because I think it's really important to raise awareness of this illness.